A confused mind, fear, isolation, jobless and helpless. Things are difficult. Let's overcome these difficulties together. Don't shut away your thoughts and feelings. Remember, you are not alone. Call 1926, the National Mental Health Helpline.
Hello everyone, welcome to Adadharana Biz 24. Today's discussion is related to the COVID-19 global pandemic situation we've all been facing for more than a year now. When talking about the COVID-19 global pandemic situation, we know businesses around the world were facing so many issues and they had to take a U-turn. And when talking about businesses coming into Sri Lanka, we all know micro, small and medium enterprise sector plays a significant role in the Sri Lankan economy. But they're also the ones who had to face a severe affection of the COVID-19 pandemic. Now, talking about the affected micro, small and medium enterprises in Sri Lanka, there are two parts. When talking about the business aspect, we all know entrepreneurs, some of the entrepreneurs actually had to shut down their businesses. And on the other hand, with the individual aspect, we know we have so many among us who lost their jobs due to this global pandemic situation. Now, due to this whole scenario of the global pandemic situation where people had to shut down their businesses, lay off people and lost their own jobs, this had affected the psychological aspect of so many people. And that's exactly what we're going to talk about during this program today under the title, Healthy Socio-Economic Recovery of Micro and Small Enterprise Sector of Sri Lanka. And to talk about this, I have two special guests with me today. And let me introduce them to you first. First of all, let me introduce the Director, International Labour Organization, Country Office for Sri Lanka and Maldives, Ms. Simrin Singh. Hello to you. And next, I would like to introduce Officer in Charge of World Health Organization, Sri Lanka, Dr. Olivia Nieveres. A very big hello to you as well. So, to get the conversation started, let's talk about the effects of COVID-19 pandemic on the whole population of Sri Lanka, depending on the mental aspect. What are your views? I'll start with Dr. Olivia.
Yeah, every one of us is affected by this pandemic, no? And there are those who are directly affected, those who have suffered from COVID-19, those who are under treatment or with a family member or a friend.
Mm-hmm.
And indirectly, like what you have said, Ashi, we have, these financial difficulties, businesses closing down, and social isolation, all these things. This has really affected every one of us. And we have seen increase in panic attacks, anxiety disorders, depression, or just like this feeling of being alone or having that kind of not so good mental health condition. So everyone has been affected at different levels, different degrees.
While everyone has been affected at different degrees due to this COVID-19 pandemic, I would like to ask Ms. Simrin, how has this pandemic affected on the world of work, especially focusing on our title today on micro, small and medium enterprise sector in Sri Lanka?
Yeah, it has had quite an impact on this sector. I would say this sector is those that have employees of less than 50. So these are quite small, but by and large, many of them are actually outfits that have maybe 10 people, maybe 5, some self-employed. And I think the stress, the depression and anxiety has been aggravated quite significantly because I think the financial side, they were already in a very precarious situation prior to the pandemic. Many were already in debt, for example. They borrowed to keep their businesses running or to start something. And with the pandemic, those sources of income also stopped. So not only did they have to perhaps shut down and lay off their employees, but they fell further into debt. And if you talk to those that are looking at mental health issues, the financial stresses that one suffers, especially if you're in a situation of debt, is really significant, and it got amplified significantly on this population. The other factor to consider is that there's also a difference between whether you're a male entrepreneur or a female entrepreneur or employee. I think a lot of women also were all of a sudden forced to work from home. There were increased incidences, as you know, of domestic violence, of alcohol abuse.
Yeah.
All of these are telltale signs, and many of the women disproportionately also suffered as a result of this, not to mention the stresses of childcare and elder care responsibilities if you're not working, that added stress, children not going to school, not only just the fear of getting sick and getting COVID, but actually the workplace became home. Right? And at home you had children and elders and perhaps an abusive situation because everyone's under stress. So all of those things have really significantly, I think, had quite an impact, and we do need to look at it from that lens because we often think of the workplace as a big factory or an office building.
Yeah.
We don't really look at how these operate. I just want to say also this issue of transportation adds a sense of fear. We knew that there was already violence and issues in public transportation, especially for women, but we knew that the fear of contracting COVID through transport to and from work also added to a whole level of anxiety. So the whole blending of the home work situation plus the financial indebtedness and precariousness, I think really has had quite a significant impact, resulting in these disorders. I mean, not these conditions.
And we should look at it in a holistic way, like what you said. No?
I think from the start itself of this conversation, you and I can definitely relate to this situation. We will be back after a short break. Welcome back after the break. So before the break, we were talking about how COVID-19 had an impact on the working world. So right now, we would like to go into detail with Ms. Simran. Let's talk about the two aspects of, on the sides of employer and on the sides of an employee.
Yeah, so if you look at it from the perspective of employer, what we found is that the biggest issue that they had was the lack of working capital, basically to keep the businesses afloat, right? Or to pay salaries to their employees. So that resulted in income losses, and that as a huge stress. The other stress for employers has been the fact that they didn't have access to the markets the way they did. To be able to supply their goods and sell them as well, whether it was in lockdown or for other restricted reasons. So from an employer's perspective, that adds a huge amount of stress because you have the responsibility also of making sure your employees stay, get paid, are taken care of, are not fearful. And their role in terms of also being able to detect when they see their employees not doing so well has to be also amplified. I think from an employee's perspective as well, you're very afraid. Am I going to have my job tomorrow? Am I going to get paid tomorrow? How am I going to get to work without getting sick to and fro? Who can I talk to? Because I'm spending so much time at home, and there are things that are not doing well at home. So there are all of these fears also that an employee has and might not necessarily know also the stresses that the employer has, which is how can I make, pay or access these products so that I can keep you on board. So I think there's a need to mutually understand that both employers and employees face incredible stress and their mental well-being, and so really keeping an eye sensitive to that fact, an eye and an ear open, and trying to be patient and helping each other and identifying how you can support. I think if you acknowledge and understand the perspective where they're coming from, and you talk about it, and you create a supportive environment, a non-threatening supportive environment, it can go a very, very long way.
I think that says it all. Like it is important to look into these issues. So in that context, I would like to ask Dr. Olivia.
Can I add on to what she said?
Yeah, sure.
I think what Simran said about employees and employers having that good communication, really understanding, because each one of us has a different context, different conditions. And as an employee, for example, I play many roles. As a sister, as a daughter, like, head of the household and everything. So we really have to look at it in a holistic view, like what she said, and try to communicate even virtually. So yeah,
I think
Ashi,
this
sorry.
no problem. So I think this pandemic situation brought us back to our basic values of communicating, leadership, like the
Right, yeah.
basics. We have actually forgotten, like opened our eyes for a moment, I think. So on that factor, Dr. Olivia, why do you think it is important to strengthen the mental health and psychological support? And under this COVID-19, are there any interventions that have been taken in Sri Lanka?
Thanks, Ashi. I would like to parrot what one of our, actually the WHO said. There can be no health and sustainable development without mental health. So with that, I would like to support that with a study done by Lancet Psychiatry that says $1 of investment in mental health would give you $4 return. So I don't know how, if that is applicable to Sri Lanka.
Yeah, definitely.
But in global evidence shows that 1:4. So I think that's a very good return on investment. And in terms of what the country is doing, they have done a lot for mental health and psychosocial support in communities, districts, and at the central level. In fact, the National Mental Health Policy has been approved by the Cabinet in 2020, and that can guide the overall approach in terms of improving mental health and psychosocial support, not only for COVID, but for the entire country in terms
In
of
general.
like essential services. And then I think we also need, they have strengthened psychosocial first aid with the engagement of other partners at the community level. And the mental health helpline 1926, 1926. It's an initiative by the Ministry of Health, Mental Health Department, Sri Lanka Telecom, and the National Mental Health Center. And this helpline has received, I think, 3 times more calls during the COVID. It has been there before the COVID, but during the COVID period, it has received 3 more times the number of usual calls. And WHO is helping expand this not only to several districts but nationwide, so that we can have an institutionalized way for people to assess help when they need. And we also have this Mitusu Piyasa, something like that, in health facilities, and the mental health and the women helpline also is there.
Yeah.
So there are many ways on how we can support these people who are having some problems in terms of
mental health
and,
issues. I think those are the helplines that they can actually access. But I would like to also understand by Ms. Simri, how does this whole process work? How can one reach out for guidelines and for help?
Well, I think being on a show like yours is a good start as well. I think, we have to really publicize it. First, we have to really also make sure that it's not looked at, mental health is not looked at as a problem, as a disease, as something that's awful. First step is to acknowledge that, yes, people are suffering. These are the symptoms of it, to acknowledge it, and we need to raise awareness of these. And to make it okay for them to contact these helplines, okay for them to reach out to the local healthcare worker or whoever might be. But those people also do need training. One thing that this COVID-19 thing has brought to light on the positive side has been a greater recognition of the psychosocial well-being aspects that are so needed, and also a bit more of an aggression, with more aggression to get those services out. But on the other side, which has been a struggle, and I think it continues to be in Sri Lanka, is that we don't have that many mental health professional services available. So that's been the call, and I think WHO, ILO, together with the health ministry and other entities, are really looking to see how we can expand the circuit, especially down at the community level. Because calling a helpline is one thing, but knowing that you have a supportive community goes very, very far in trying to help alleviate this problem. But first, it's to recognize the fact that there is mental health and what is good mental health and well-being and what's not, and how can we go about dealing with it, improving.
I think the best part I took from what you said is people need to understand that it's okay to undergo these
Yeah.
situations, and it's a matter of getting help. So yeah, it's always
And
a
actually,
matter
can
of
I
getting-
add on to what she said about stigma and discrimination of mental health? You know, we can do a lot at our level. Instead of calling a person mentally ill, you can say a person with mental health condition, or something like saying having like a COVID-19 case, you can say a person diagnosed with COVID-19, or
It's a matter of
yeah.
replacing
Yeah.
with nicer
Yeah,
words
it
and
is.
normalizing it.
and not
Exactly.
stigmatizing and
Yeah.
discriminating. So I think
'Cause
that's
that
important.
adds to the-
yeah, that adds to the stigma.
Yeah. It's all about accepting what you're going through and asking for help, and it's okay to go through and ask help for mental conditions. So we will be back after a short break.
We were able to be together till the pandemic came along. It distances us socially and physically, affecting us mentally. It's harder to talk or listen as we did, and we feel helpless. Don't shut away your thoughts and feelings. Remember, you are not alone. Call 1926, the National Mental Health Helpline.
Welcome back after the break. Sri Lanka, being a developing country where we are still trying to normalize the mental health and psychological support system, I think it is important to know how you all as an organization, as subject experts, try to get this to the society other than the helplines that are already available. Ms. Simran, if you would like to.
Sure, Ashi, and I think I'll obviously answer this in the context of the world of work.
Sure.
As we have progressed and businesses are trying to reopen, et cetera, after COVID, it's really important that those that they interact with, be it to get that financial loan to restart the business, or be it to get advice to make sure that the labor situation is fine in their premises where they're operating. So it's really important also to target those that are interacting with them on a daily basis beyond just the healthcare helpline or health experts. For example, the enterprise division officers based at the district secretariat level, the labor officers, they really, and also the financial institutions, the banks that might be trying to go and offer loans under incredible schemes that have been set up in the country to be able to access and rebuild these micro small enterprises. So they need to be sensitized on the psychosocial aspect, as well as on how they can deliver and be more nurturing and understanding of the difficulties and anxieties faced by the workers and employers in that segment, so that they can be more trust and avail better services as a result of that. I think that's really important, that we should also include them and not just say it's the
Definitely.
jurisdiction of healthcare workers and a helpline and
Yeah.
counselors.
Yeah. They should be trained actually.
Yeah,
You know.
they need
Yeah.
to.
Yeah.
On that important note, as we have come to the closing of today's program, I would like to get key messages from you all. I'm sure you all have a lot to say to the public who are watching us right now. I will start with Dr. Oliver.
Yeah, from the health perspective, if you are suffering from some kind of mental health condition, please do seek help. And we as people, we can do a lot of things to improve the mental health well-being of everyone by being kind and compassionate, being understanding and flexible. Like what Simrin has said, maybe in our workplaces, if we are managers or supervisors, we can initiate healthy workplace settings, having a respectful workplace, which is being done also in the UN and WHO. Zero harassment, that kind of things are very important. Small, but it really makes a difference. And while we are now having the vaccine, please do observe public health and social measures and have yourself vaccinated. And in the meantime, let's all hope and pray that in 2021, 2022, we'll overcome this together. Thank you.
Thank you. From Ms. Simran also, I would like to take a message in brief.
Okay, so the COVID pandemic has been a real eye-opener, but we now are on the road of trying to see how we can make things better, how we can make people's livelihoods better. And the merger between the home and family and the work life has never been more stark than it has become now. I think it's an opportunity, a real opportunity for us to also be more sensitive to the human side of this pandemic. And that by the human side, I mean also the psychological side, and to go forward with a keener understanding of how the psychological side of things can actually not just affect negatively, but can be used to build back a more positive working environment, free of harassment, free of violence, and understanding that the working environment is not just one in factory settings, but in all sorts of settings, including home-based work. So I think this extended knowledge is really a good starter and opportunity. Adhering to good health safety guidelines, of course, COVID is not gone. It's still very much there. So while you look at hand sanitization and masks and all of those other things, I think a keener understanding of the psychosocial aspects is really essential going forward in terms of starting and thriving. And of course, the ILO is here. We're a 100-year-old organization working very much with micro, small enterprises, and we are here to work with the people of Sri Lanka, with the businesses and the employees to build back better, even better. Thank you.
Very well said.
Thank you so much. Thank you so much to Dr. Olivia, and thank you to Ms. Simran as well. And thank you for your contribution to the country as well. We definitely appreciate your support. On that note, we have come to the end of today's session where we were in discussion about the healthy socio-economic recovery of micro and small enterprise sector in Sri Lanka with the Director, International Labour Organization, Country Office Sri Lanka, Ms. Simran Singh, and also the Officer in Charge of WHO Sri Lanka, Dr. Olivia Niveras. And thank you so much for watching. To make a difference is why we are all here for, and I think we were successful in giving that to you. So just like you take care of your body, it's important to take care of your mind and mentality and the soul as well. So good luck in doing that. Seek for support, and it's okay to be wherever you are right now. We shall see you soon with another episode of Biz 24.